Hello everyone, I welcome you all in my channel series, and today I gonna talk about attention deficit hyperactivity disorder. It is a disorder that is marked by an ongoing pattern of inattention and a hyperactivity impulsivity that interferes with the functioning or a development. Inattention, it means a person wanders off task, lacks persistence, has difficulty in sustaining focus, and is disorganized. And all these problems are due to the defiance or lack of comprehension. Hyperactivity means a person seems to move out about constantly, including in situations in which it is not appropriate or excessively fidgets, taps or talks in adults. It may be extreme restlessness or wearing out others with constant activity. Impulsivity means a person makes hasty actions that occur in the moment without first thinking about them, and that they may be have a high potential for harm or a desire for immediate rewards or inability to delay gratification. An impulsive person may be socially intrusive and exclusively interrupt others or make important decisions without considering the long term consequences. Inattention and hyperactivity are the key behaviors of ADHD. Some people with ADHD only have problems with one of the behaviors, while others have both inattention and hyperactivity or impulsivity. Most of the children have the combined type of ADHD. In preschool, the most common ADHD symptom is hyperactivity. It is normal to have some inattention, unfocused motor activity, and impulsivity. But for the people with ADHD, these behaviors are more severe, occur more often, interfere with or reduce the quality of how they function socially and the school, in college, or at the job. People with symptoms of hyperactivity, impulsivity may often fidget and squirm in their seats, leave their seats in situations when staying seated is expected, such as in the classroom or in the office, run or dash around or climb around in the situations where it is inappropriate, or in teens and adults, and often feel restless, be unable to play or engage in hobbies quietly, be constantly in motion or on the go, or act as if driven by the motor, talk non-stop, blunt out and answer before a question has been completed, finish other people's sentences and speak without waiting for a turn, or speak without waiting for a turn in a conversation, having trouble waiting for his or her turn, interrupt or intrude on others, for example, in conversation, games, or activities. Diagnosis of ADHD require a comprehensive evaluation by a licensed clinical such as pediatrician, physiologist, or physiotherapist with the advertised in ADHD. For a person to receive a diagnosis of ADHD, the symptoms of inattention or a hyperactivity impulsivity may be chronic or long lasting, impair the functions of the person, and cause the person to fail behind typical development of his or her age. The doctor will also ensure that ADHD symptoms are not due to another medical or physiotherapist condition. Most other children with ADHD receive a diagnosis during the elementary school years. For an adolescent or an adult to receive a diagnosis of ADHD, the symptoms need to have been present before the age of 12. ADHD symptoms can appear as early as the between the ages of 3 and 6 and can continue through adolescence and adulthood. Symptoms of ADHD can be mistaken for emotional disciplinary symptoms and the problems, or mislies entry in quiet, well behaved children, leading to a delay in diagnosis. Adults with underdiagnosed ADHD may have a history of poor academic performance, problems at work, or difficulty in failed relationships. ADHD symptoms can change over the time as the person changes. In young children with ADHD, hyperactivity and impulsivity is the most predominant situation and the symptom. Researchers are not sure what causes ADHD. Like many other illness, several factors can contribute to ADHD such as genes, cigarette smoking, alcohol use and drug use during pregnancy, exposure to environmental toxins during pregnancy, exposure to environmental toxins such as high level of lead at a younger age, low birth weight, brain injuries. ADHD is more common in males more than females, and females with ADHD are more likely to have problems primarily with inattention. Other conditions such as learning disabilities, anxiety disorder, conduct disorder, depression, or and substance abuse are common in the people with ADHD. While there is no cure for ADHD currently, available treatments can help reduce symptoms and improve functioning. Treatments include meditation, physiotherapy, education, or training, or a combination of treatments like stimulants.
I got broads in Atlanta, just to throw me in the family. Credit cards and the scammers, getting no licks in the bank. Legacies.